السلام عليكم. الجزء الثاني من محاضرة Immunity and Allergy.
In this lecture, we will focus on the types of the lymphocytes and then we will talk about their function. Also, we will talk about the types of immunization. Then we will talk about the allergy.
In this lecture, we will talk about cell-mediated immunity by the T lymphocyte. We have three major types of the T lymphocyte: helper T cell, cytotoxic T cell, and suppressor T cells. Now we will focus on the helper T cells. It is the most numerous type. هي الخلية الأكثر عددا من أنواع T lymphocyte, and it is the major regulator of all immune function by forming lymphokines. What are the most important types of the lymphokines? Are the following: interleukin 2 up to the interleukin 6, and the granulocyte monocyte colony stimulating factor in addition to the interferon. What are the function of these T helper lymphokines? This is T helper cell. This is the receptor for attaching antigen. This is the antigen. Once this antigen attached for this receptor, lead to activation of the T helper cells and formation of the lymphokines. These lymphokines lead to the stimulation of the growth and the proliferation of the cytotoxic T cells and suppressor T cells. In addition to that, these lymphokines lead to stimulation of the B cells growth and differentiation to form plasma cells and antibodies. In addition to that, these lymphokines lead to the activation of the macrophage system and formation of the interleukin 1. And finally, these lymphokines lead to the has a stimulatory effect on the helper T cells themselves. So in the absence of these lymphokines from the helper T cells lead to the body without any immunity, as happened in the acquired immunodeficiency syndrome, which is called AIDS. At this syndrome, the virus destroys the helper T cell and there is no lymphokines formation. This leads to the totally unprotected body against any infection, disease, and lethal effects occur. cytotoxic T cells هذا النوع من أنواع التي ليمفوسايت راح تحارب العدو مباشرة، ولهذا نسميها الكيلر سيل. So this cytotoxic T cell is a direct attack cell. راح تحارب الانفيدر directly. Its attack starts by secrete perforins. This perforins هذه المادة راح تعمل لنا holes ثقوب in the membrane of the attacked cells. راح تعمل لنا ثقوب في الخلية اللي عطرية تحاربها السيتوتوكسيك cells. This lead to a flow of the interstitial fluid to the inside the invader or attacked cells and lead to rupture of the attacked cells. In addition to that, the cytotoxic cells secrete cytotoxic substance into this attacked cell. This is the attacked cell. This is the cytotoxic T cells will attach to the attacked cell and do a hole in the membrane of the attacked cell, lead to entrance of the interstitial fluid inside this attacked cell and rupture it. In addition to that, this cytotoxic cells secrete cytotoxic and digestive enzyme to the inside this attacked cell. suppressor T cell راح تقلل لنا من فعالية كلا خليتين cytotoxic and helper T cells، ولهذا راح تمنع excessive immune reaction of both type of this cell which might lead to damage of the body own tissue حتى لا تتمادى فعالية المناعة إلى أن تحطم أنسجة الجسم الطبيعية. The immune mechanism normally can recognize the normal own tissue and do not destroy them. Otherwise, if it is not recognize them, this lead to the autoimmune disease. Immunization by injection of the antigen هي عملية إكساب مناعة للشخص بواسطة حقنه بأنتيجين. هي نوع من أنواع الأكتيف immunity، ومثال عليها هي الفاكسينيشن. Immunization produce acquired immunity against a specific disease by injecting dead or attenuated organism of the disease. يعني إما راح نحقن أنتيجين ميت أو أنتيجين مضاعف of that disease. الأنتيجين المضاعف هو يعني ما بعد يستطيع أنه يؤدينا إلى المرض، but still يعني يبقى عنده صفات كيميائية للأنتيجين. وليش قلنا عليها الاميونيزيشن اكتيف immunity؟ لأنه الجسم راح يبدي يعمل لنا antibody against this dead or attenuated organism of the disease. Passive immunity it is a temporary immunity، هي مناعة مؤقتة ممكن الحصول عليها بواسطة أخذ أجسام مضادة أو activated T cells أو كلاهما من دم شخص آخر أو من حيوان أصيب بالمرض المعين أو it has been actively immunized against this antigen. Why it is temporary immunity? Because this antibody will last in the body of the recipient المستلم. راح تبقى هذه الأجسام المضادة في جسم المستلم لمدة فقط أسبوعين إلى 3. هذه بالنسبة للأنتيبودي. While for the activated T cells which is taken from the human being, it can last for a few weeks. Allergy and hypersensitivity, they are important side effects of immunity. يعني أعراض جانبية تحدث للشخص نتيجة المناعة. Their types are either delayed reaction of allergy or allergies. We will talk on each type alone. The delayed reaction allergy, this type of the allergy caused by the activated T cells, either helper or cytotoxic T cells, but not by antibodies. This allergy is formed on the repeated exposure. Is formed on the repeated exposure to the antigen as toxin, but it is not on the first time exposure. So after the second exposure, this to the antigen, after the second exposure to the antigen, this lead to the serious damage in the tissue at which the antigen is present, such as the skin in case of the poison IV. يعني راح يصير احمرار للجلد عند التحسس لمادة معينة. The second type, which is allergy, some people have the allergic tendency، قابلية لأن يحصل لهم التحسس اللي نسميها atopic allergies. هذه النوع من الحساسية it is hereditary passed from parents to child، يعني موروثة من الأبوين، and it is characterized by the presence of the large quantity of the IgE antibodies in the blood. إذا ميزتها إنه وجود كمية كبيرة من ال IgE antibody in the blood. This IgE antibody will attach to the mast cell and basophil. So when this immunoglobulin E bind with the allergen, الألرجين هو الأنتيجين that cause the allergy. This binding of the IgE with the allergen lead to rupture of the many of the mast cell and basophils, and lead to release many substances like histamine, protease, slow reacting substance of the anaphylaxis, eosinophil, and neutrophil chemotactic substance, in addition to the heparin and platelet activating factors. these substances which are released from the muscle and basophil, leading to the following. First of all, dilatation of the local blood vessels and attraction of the eosinophil and neutrophil to the reactive site, increase the permeability of the capillary with loss of the fluid into the tissue, finally contraction of the local smooth muscle cells. Example of this allergy, first of all, anaphylaxis, when the allergen is injected directly into the circulation، يعني لما الأنتيجين يحقن مباشرة إلى الدم في تحدث في عمليات نقل الدم، وأيضا عندما تحقن أنتيبيوتيك يكون الشخص متحسس لهذا النوع من الأنتيبيوتيك. النوع الثاني ارتكاريا، يحصل حكة في الجلد نتيجة لدخول الأنتيجين مباشرة بالسكن. Hay fever means there is allergy reaction which is occur in the nose leading to the sneezing, and finally asthma which is allergic reaction which is occur at the bronchiole of the lungs. We conclude from this lecture that there are three types of lymphocyte: helper T cells that act as regulator of immunity, cytotoxic T cells which is act as a direct attack for invader, and the third type is suppressor T cell which suppress the function of both helper and cytotoxic T cell. Also there are active and passive immunization, and there are allergy and hypersensitivity which are the important side effect of immunity. Thanks for your listening.